Tonight we are digging into seasonal respiratory viruses and the impact they're having here in Oklahoma.
One of the biggest ones we're watching right now, the flu. Take a look at this viral view chart from the Oklahoma State Department of Health. You can see influenza at a high risk, which means there's an increased risk of exposure. The virus also considered widespread. This was determined by how many positive tests there have been, wastewater data, and hospitalizations during a 4-week period. As for RSV, currently a moderate risk of exposure, and the trend is considered stable this week. COVID-19 considered low risk right now, and the trend is also considered stable. The rise in illnesses causing several schools across the state to switch to virtual learning this week because so many of their students and staff members are sick.
Fox 25's Grant Palmer spoke with experts at Mercy Hospital who say while we are in a flu epidemic, it's nothing we haven't seen before.
It is winter and especially cold weather. People get together more inside, so we're having a flu epidemic.
That's what Kelly Stevens says we are in the thick of right now, as several schools across Oklahoma have been forced to close and move to virtual learning due to a high number of students and staff sick with illness, including Ponca City Middle and High School last week, Tuttle High School Friday, as well as Central and Gans Public School, which are even cleaning and sanitizing its buildings.
They're all together all day long, over and over again. And with the policies of missing school, then you're told to keep your child home if they're sick, but then you have to provide some sort of documentation of why they weren't at school that day. And so people often send their kids to school who they might be a little bit sick, and then they get sick during the day.
According to the State Department of Health's most recent influenza data, every HHS region in Oklahoma has an influenza percent positivity above baseline. While activity is high, Stevens says the high number of cases comes and goes in cycles, and he says the best thing to do to try to prevent yourself from getting respiratory illnesses is very simple.
I have a relative who is a teacher, and she has a mantra. She says in class, basically, if you go outside, wash your hands. If you go to the bathroom, wash your hands. If you touch your face, wash your hands. So if you fill in the blank, wash your hands.
Reporting for Fox 25 News, I'm Grant Palmer.
Not only are flu cases on the rise, so are hospitalizations associated with the virus. The blue bars on this graph show the increase that we've seen in the state over the past 5 weeks. Last week alone, there were at least 275 flu-associated hospitalizations. Now, according to the State Department of Health, a large portion of those hospitalizations have been Oklahomans 65 and older. You can see by the pink line. Another line that you see climbing is the light blue. That represents children up to 4 years old, while kids ages 5 to 17 are among the lowest for hospitalizations. You can see we are starting to see an uptick in that age group as well.
We're joined here with Dr. Ryan Brown. We want to talk about RSV and the flu. Those temperatures starting to get warmer, but we are still in the middle of the season when it comes to RSV and flu. And it's kind of one of those things, Dr. Brown, where you just talk to people and there's just what they describe as just kind of the crud, right? Something that's just kind of going around right now.
It is. We're seeing it in infants, toddlers, teenagers, and even adults. And unfortunately, it's not just an isolated issue. It's once somebody gets it in the house, they all fall like dominoes. So it's one kid gets it, and then the next kid gets it, and then the third day I see a third kid that's gotten it. So it's happening.
What? I don't mean to over dramatize this or anything, but what causes this thing to kind of just make all the dominoes fall and spread like wildfire like this? Because I can't remember for a while something that just has spread around so quickly.
Well, you know, it's winter. Everybody goes inside. We kind of drop our guard a little bit when it comes to like hand washing and just hygiene of, you know, coughing in our hands and touching objects and such. So we see a lot of that can go on. And plus, you know, kids are kids. Kids like to play. They interact with each other. We go to birthdays. Birthdays are now more inside than they are outside. And so we're just spreading it because we're just closer together than we are in the spring and in the summer times.
You kind of talk about kids being in close quarters like that. What do you think is the best way for parents to have that conversation with their children of, hey, we just got to take that extra 25 to 30 seconds, do our due diligence and stay clean here. And it's not just for you, but it's for everybody that you're around.
Right. It's washing your hands, be a little bit, coughing in your sleeve, in your elbow, than rather in your hands. Hand sanitizer when you're going out, just grab some, throw it in your purse, throw it in your bag. That can be effective as well. And just kind of just being cognizant of, hey, if I'm sick, I may just stay home today, or if Johnny's sick, we may just stay home today. We'll catch him next time, and just be aware that if I'm not feeling well, maybe I don't want to get somebody else not feeling well later.
And how do you have that conversation with a child to sort of make them understand the impact they could have if they're not taking those steps?
It's like a domino. It's like, hey, let's play dominoes, and you're sick, and then if you get sick, you can kind of fall over and hit this kid that's sick, and you can just have that conversation, like, it's not just us, but I can get Johnny sick, and Johnny can get Susie sick, and Susie can get Melissa sick, and Melissa can get Bobby sick, and just kind of and just tell them that it's not really their fault. Unfortunately, it's just the way that we are. It's in the season that we're in right now, and if they get sad about not being able to do something fun because they themselves are sick and are running a fever, make it fun at home. You can still have fun at home with a sick child. To take their mind off of things, to do it, because obviously we want to do things for kids to let them have fun. You can do that at home with a sick kid as well.
Yeah, always let them know there's going to be a next one, right? They're never going to miss the last one there. Dr. Brown, we thank you for your time here and help keeping us all safe and feeling good this time of year.
Please, wash your hands, wash your hands, wash your hands.
Norman Regional Health System alerting the community tonight about a surge in flu and RSV cases at their facilities.
Fox 25's David Chasanoff spoke with doctors about the trend. David, how many flu cases have they seen so far this year?
Adam, Wendy, here at Norman Regional, I'm told they've seen 215 patients test positive for the flu since January 1st. And that's a big difference from last year when they only saw 55 cases.
So these numbers have grown this year. Why? I think it's because there's more what we call virulent, stronger strains.
Dr. Nikki Rodriguez says physicians within her health system are far too familiar with the flu this time of year.
I would say up to 40%, even some days up to 60 to 70% of the day is flu positive on a rapid test.
The clinical lab manager here says they can test up to 40 samples at a time using this machine, and they can get results in under an hour.
We're a fully automated lab, so our automation up front takes care of all of our chemistry and hematology samples, so that really frees up more time for these kind of tests that are more hands-on.
Zachary Ratzliff says his lab is able to PCR test one sample for flu A, flu B, RSV, and COVID.
Help save the patient some pain and some discomfort with all those collections.
According to Ratzliff, last year it took 3 to 4 hours to get a test result, whereas now it can take as little as 45 minutes.
It's really important. The faster that we can get you an answer, the faster that you can get treated for these viruses.
So testing technology has definitely improved here in Cleveland County, and there's actually a drive-through testing collection facility right across the street where we are here at the West Norman Lab. You can see right here, you can just get a quick test and a quick swab and those quick results like you get at Norman Regional just across the street. You'll just need a doctor's order. Reporting live in Norman, David Chasanoff, Fox 25 News.
David, thank you. And that was your big story breakdown tonight. You can learn more about the rise of seasonal respiratory viruses in Oklahoma on OKCFox.com.